9 popular medications that can trigger rapid dementia. It's a shocking statistic. Every 66 seconds, another senior in our country receives a diagnosis of dementia. By the time you finish watching this, an additional 20 families will have heard those devastating words. For some, the root cause isn't simply getting older. It's a bottle on their bathroom shelf, something they were assured was harmless that's secretly causing harm. I'm Dr. John Myers, and after 15 years of practicing medicine, I've seen this exact scenario unfold countless times. Someone who has been sharp their entire life begins to lose their train of thought. They forget names, appointments, even routes they've driven thousands of times. And tragically, everyone around them often dismisses it as just a normal part of aging. But it's not. It's a medication. A medication that most people never question because a doctor prescribed it and a pharmacy dispensed it. Newer research is consistently showing something deeply concerning. A common class of everyday drugs can significantly impair memory and learning within a single year. And the most alarming part? Most people taking these medications have no idea it's happening. Today, I'm going to walk you through 9 medications that are most strongly linked to rapid memory loss. We'll count them down, starting with those that are often overlooked and ending with what I consider the most destructive. Pay close attention to number 3. It's given to millions of seniors for reasons that sound completely benign, and it might be silently shrinking the memory centers of your brain right now without any warning signs. Before we dive in, I'd love to hear from you in the comments. How old are you, and what medications do you take every day? I read every comment, and your age helps me tailor the information I share. Let's begin with number 9. And don't let its position on the list fool you, because this drug is likely in almost every medicine cabinet across the country. Number 9. Diphenhydramine. You probably know it by its common drugstore name, Benadryl. It's that little pink pill many people reach for when they can't sleep, when allergies strike, or to take the edge off a cold. It's inexpensive, readily available without a prescription, and because of that, most people assume it's gentle and safe. However, inside your brain, Benadryl is doing something quite different. It belongs to a group of drugs called anticholinergics. This might sound like a complicated term, but it refers to a simple mechanism. These drugs block a crucial brain chemical called acetylcholine. Acetylcholine is like a messenger in your brain. It's essential for creating new memories and for staying alert throughout the day. As we get older, our brains naturally produce less acetylcholine, making us more reliant on what we have left. So, a drug that blocks this vital messenger has a much more profound impact on a 70-year-old brain than on a 30-year-old one. The area of the brain that takes the biggest hit is the hippocampus, a small, seahorse-shaped structure vital for forming new memories before they are stored away. In my practice, I've seen patients who have taken an antihistamine every night for years, slowly experiencing a decline in their mental sharpness, and they never once connected that brain fog to the little pink pill by their bedside. Research clearly supports this connection. A study published in the Journal of Geriatric Cognitive Health in 2023 followed older adults who regularly used anticholinergic drugs. They found a staggering 54% increased risk of developing dementia compared to those who avoided these medications. That's more than double the normal risk from something most of us treat like candy. Here's what you can do. Carefully read the labels of anything you take to help you sleep. Anything marked PM, nighttime, or allergy relief. These often contain diphenhydramine under a different name. If you take it for allergies, consider newer antihistamines like loratadine, Claritin, which don't cross into the brain in the same way Benadryl does and are much safer for long-term use. Remember, never stop a medication on your own. Always discuss any concerns with your doctor. But it's time to stop assuming that over-the-counter automatically means safe for your memory. That's number 9. Number 8, proton pump inhibitors. This next medication is something your stomach often loves, but your brain quietly pays the price for. Number 8 on our list are proton pump inhibitors, or PPIs. You likely know the common brand names like omeprazole, Prilosec, and esomeprazole, Nexium. These drugs work by drastically reducing acid production in your stomach, and they're frequently prescribed for heartburn, acid reflux, and that uncomfortable burning sensation after meals. People often stay on them for years, even decades, because the moment they stop, their symptoms return with a vengeance, making the drug feel like the only thing keeping their discomfort at bay. But here's a crucial piece of information that often gets overlooked at the pharmacy counter. Your stomach actually needs acid to effectively extract certain nutrients from your food. One of the most important of these is vitamin B12, which plays a vital role in protecting the delicate wiring of your nerves and your brain. When you suppress stomach acid for too long, your B12 levels can quietly plummet. The same can happen with magnesium and calcium, two minerals that your brain cells depend on for clear signaling and proper function. When neurons are starved of these essential nutrients, you can experience misfires, confusion, and memory lapses that can eerily resemble early Alzheimer's disease, when the true culprit is a nutrient that your medication has been blocking all along. A large study published in JAMA Neurology in 2016 examined over 73,000 individuals aged 75 and older. They found that regular PPI users had a 44% higher risk of dementia compared to those who didn't take them. Furthermore, the problem runs deeper than just nutrient deficiencies. PPIs have also been shown to increase levels of amyloid beta in the brain, the sticky protein that accumulates in Alzheimer's disease. So here's the vital action step. If you are taking a PPI every single day, have a conversation with your doctor. Many people can successfully transition to a gentler class of medication called H2 blockers like famotidine, Pepcid. These are much less likely to interfere with your cognitive function. Additionally, chewing deglycerinated licorice, a natural compound that coats and soothes the stomach lining, can help manage symptoms without any negative impact on your brain. The goal should always be to use the lowest effective dose for the shortest possible duration, rather than taking a pill indefinitely out of habit. Number 7. Bladder medications. This next medication is prescribed for a problem that many people would rather not discuss. Number 7 on our list are bladder drugs, and a key one to be aware of is oxybutynin, often sold under the brand name Ditropan. It's frequently given to seniors who struggle with a sudden, urgent need to urinate, that overactive bladder condition that can significantly disrupt their daily lives. The relief it offers is undeniable, and the embarrassment it spares people is also very real. However, oxybutynin works by blocking acetylcholine, the very same memory chemical that Benadryl interferes with. What makes this drug particularly concerning is that it easily crosses into the brain and lodges itself precisely in the areas responsible for memory formation. This makes it one of the more dangerous medications on this list for older adults, especially when taken consistently over months and years. In 2019, the British Medical Journal published a study that looked at individuals over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of developing dementia was a startling 49% higher. That's nearly 1 in 2 people. What is most troubling to me is how rarely patients are warned about this potential side effect. They're told the pill will calm their bladder, but no one mentions that it might be dimming their mind simultaneously. The resulting confusion and forgetfulness are then attributed to aging. People might start forgetting appointments, misplacing keys repeatedly, or losing the thread of conversations, and everyone around them nods and says, "Well, you're getting older." This connection to the medication is rarely made until significant cognitive decline has already occurred. If you are taking oxybutynin and have noticed your memory slipping, please take that seriously. You don't have to choose between a healthy bladder and a healthy brain. Newer medications like mirabegron, Myrbetriq, work through entirely different pathways and do not block acetylcholine at all. For most older adults, they offer similar bladder control with significantly less risk to cognitive function. This is a crucial conversation to have with your doctor at your next visit. Number 6, statins. This next medication might be the most surprising one on our list because it's one of the most widely prescribed drugs globally. Number 6 are statins. Simvastatin, Zocor, and atorvastatin, Lipitor, are among the most common medications, particularly for individuals over 60. They play a crucial role in lowering cholesterol and reducing the risk of heart attacks and strokes. Statins are indeed important for many people's health, and this is not an outright condemnation of them. What I'm about to share is the often overlooked half of the story. Cholesterol does far more than just impact your heart health. Your brain is composed of roughly 60% fat, and it relies heavily on cholesterol to build the myelin sheath, the protective insulation around every nerve fiber that allows signals to travel quickly and clearly. If you lower your cholesterol too aggressively with a potent statin, you can inadvertently deprive your brain of a critical building material it needs. The statins that tend to cause the most cognitive issues are those that readily cross into brain tissue. A 2023 study published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. The higher the statin dose, the more pronounced this cognitive decline. Some patients described frightening episodes of forgetting familiar names, recalling conversations they had just finished, or suddenly feeling unfamiliar with routes they had driven for decades. It's crucial to understand that not all statins affect the brain in the same way. Pravastatin and rosuvastatin do not readily penetrate brain tissue and are generally considered safer options for cognitive health. So, if you've been on a statin for years and you're noticing increased brain fog, forgetfulness, or confusion, this is a conversation absolutely worth having with your doctor about potentially lowering your dose or switching to a different medication. This is not a reason to stop taking a drug that might be protecting your heart, but rather an opportunity to ensure you have the right plan in place with medical guidance, not on your own. Before we continue, if this information is resonating with you and helping you connect the dots, please take a moment to tap the like button. It genuinely helps this video reach more seniors who need to hear this vital information. And while you're down there, tell me how many prescriptions you are currently taking. I read every single comment. All right, let's get back to our countdown. Number 5, benzodiazepines. Number 5 on our list are the benzodiazepines. You've likely heard of lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax. These are among the most frequently prescribed drugs in America, used to manage anxiety and insomnia. They work by enhancing GABA, your brain's own calming neurotransmitter, which helps to slow down a racing, overstimulated nervous system. Initially, they can feel like a lifesaver. Panic subsides, racing thoughts cease, and sleep finally arrives. However, over time, the picture changes dramatically. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years and discovered that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting ones, like diazepam, were found to be even more problematic because they tend to linger in the body and accumulate in fatty tissues, including the brain. Essentially, these drugs cause a slow chemical sedation of the entire brain. Learning new things becomes more difficult, and the brain's flexibility decreases. Many people describe a sense of flatness, of moving through a fog, and of not quite feeling like themselves anymore. The cruelest part is the exit strategy. If you stop taking a benzodiazepine abruptly, the anxiety and insomnia can return with twice the intensity, often accompanied by agitation that can be genuinely dangerous. This makes the pill feel essential precisely when it is causing the most harm. So, here's a critical rule that cannot be stressed enough. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly. This can be life-threatening. You must work with your doctor to gradually taper down the dose over weeks or even months. Fortunately, gentler options are available. For anxiety, buspirone is a medication that doesn't cause sedation or cloud the mind. For insomnia and anxiety, there are forms of talk therapy specifically designed to bring calm back without the cognitive cost. Number 4, tricyclic antidepressants. This next medication is a single pill prescribed for 3 different issues, and it carries one of the heaviest hidden burdens of all. Number 4 is amitriptyline, often sold as Elavil. It's an older antidepressant that is still prescribed today for nerve pain, for sleep issues, and even to prevent migraines. Its versatility is precisely why it has spread so quietly through prescriptions. It seems like a do-it-all pill. However, underneath its broad applications lies one of the most potent anticholinergic drugs still in widespread use. This means it strongly blocks acetylcholine, the very chemical that your neurons need to communicate with each other and to lock in new memories. It blocks acetylcholine so effectively that with long-term use, the impact on memory shifts from being a rare side effect to becoming an expected outcome. In 2015, a large study in JAMA Internal Medicine tracked over 3,400 adults aged 65 and older. Those who had the highest cumulative exposure to anticholinergic drugs like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. And in a heartbreaking echo of what we've heard before, almost none of these individuals were ever informed that the pill could have this effect. They received it for sleep or pain and then slowly noticed words disappearing, their memory thinning, and their concentration fraying, eventually attributing it all to age. It doesn't even require a high dose. A small nightly dose taken for years can quietly erode brain power without any obvious symptoms until the loss is significant. If you or someone you love takes amitriptyline, this is a conversation that is absolutely worth having with your doctor soon. For nerve pain, options like duloxetine or gabapentin can offer similar relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is much gentler on this crucial brain chemical, can be effective alternatives. And for mood support, newer antidepressants like sertraline or escitalopram are considered significantly safer for the long-term health of the brain. Number 3, paroxetine, Paxil. This is the one I specifically told you to watch for, as it's given to millions for reasons that sound completely harmless. Number 3 is paroxetine, commonly known as Paxil. It's one of the most frequently prescribed medications within a family of antidepressants called SSRIs, used to treat depression and anxiety. On the surface, it appears to be a modern, gentler option, kinder than the older psychiatric drugs. Here's the detail that is rarely mentioned. Paroxetine is the only SSRI that possesses significant anticholinergic activity. This single fact sets it apart from its counterparts like sertraline and escitalopram because it interferes with the very same acetylcholine system that every other drug on this list has been chipping away at. In 2021, a comprehensive review published in Frontiers in Psychiatry examined older adults taking different SSRIs. They found that users of paroxetine experienced measurable declines in short-term memory, word recall, and attention within the first 12 months of use. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. There's a profound irony here, as the drug is prescribed to stabilize the mind. Yet over time, it can actually degrade the very clarity it's meant to protect. The solution here is straightforward. In older adults, paroxetine is a medication to avoid. The American Geriatric Society has formally recognized this by including it on the Beers list, a catalog of drugs considered risky for seniors, and paroxetine is on that list for precisely these reasons. If you are currently taking it, ask your doctor about switching to a safer SSRI like sertraline or escitalopram, which are gentler and do not carry the same cognitive risks. Supporting your B vitamins, especially B12 and B6, can also help naturally stabilize mood alongside this medication change. Number 2, antipsychotics. This next medication is so quietly prescribed that many people taking it have no idea what class of drug it even is. Number 2 are the antipsychotics. And this one troubles me the most because so many individuals taking them never actually agreed to be on an antipsychotic in the first place. You might recognize names like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa. These powerful drugs were originally developed and approved for severe psychiatric conditions like schizophrenia and bipolar disorder. However, today, they are frequently prescribed off-label to older adults for issues like insomnia, mild restlessness, or the agitation that can sometimes accompany dementia itself. Powerful medications intended for severe mental illness are now being used in homes and nursing facilities on seniors who are simply confused, restless, or difficult for busy staff to manage. The cost of this widespread use is steep. In 2022, a study published in Lancet Healthy Longevity tracked over 25,000 older adults. They found that those who were prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even if they had no prior history of dementia. Furthermore, these same medications increase the risk of stroke, sudden cardiac death, and the heavy sedation that often leads to falls and hospitalizations. Antipsychotics work by suppressing dopamine, a neurotransmitter that is crucial not only for mood regulation, but also for focus, planning, and memory. When dopamine levels are significantly reduced, the brain can become slow and unresponsive. This is why individuals on these medications can appear dull, flat, and almost absent, while their families grieve for someone who is still physically present. If you or a loved one is taking one of these medications, the very first step is to ask the prescribing doctor a direct question. Why was this started? And is it truly necessary, or is it being used for convenience? Many behavioral symptoms can be effectively managed without medication through consistent daily routines, reducing environmental noise and overstimulation, addressing underlying pain, and optimizing light and sleep patterns. When medication is truly indicated, using the lowest effective dose for the shortest possible duration is essential to minimize harm. Far too often, families are never informed about the profound impact these drugs can have on the brain, and they witness a decline they believe is solely due to aging, when in reality, the cause is chemical. Number 1. Anticholinergic polypharmacy. This final entry isn't a single drug at all, but it may be the biggest hidden driver of every story I've just told you. Number 1 is anticholinergic polypharmacy. This is the danger that almost no one names, and it is likely one of the most significant causes of drug-induced memory loss in older adults. You might have been expecting one final villain drug, a single worst pill. However, the true worst-case scenario is something much subtler: the cumulative effect of taking multiple anticholinergic drugs simultaneously without anyone accounting for the total burden. Polypharmacy simply means taking many medications at once. Anticholinergic burden refers to the combined impact of all these drugs blocking that single critical memory chemical, acetylcholine, together. Picture a very common scenario. A senior takes Benadryl every night for sleep, oxybutynin every day for bladder issues, and amitriptyline for nerve pain. Individually, each of these medications might cause only a small, barely noticeable dip in cognitive function. But when taken together, they compound each other, and the total burden on the brain climbs rapidly. In 2022, a study in Age and Aging tracked over 280,000 older adults. They found that those with the highest anticholinergic burden had a staggering 120% increased risk of dementia within 10 years. That's more than double the risk. And the vast majority of these individuals had no idea they were even taking anticholinergic drugs. No one had ever explained the cumulative risk to them. When acetylcholine is blocked from multiple directions, the brain doesn't just idle. Neurons can begin to wither from disuse. Connections shrink, and the brain settles into a quiet, underpowered state that appears remarkably similar to Alzheimer's on cognitive testing. Here's the hopeful part, and it's the very reason I made this video. Drug-induced cognitive decline is often reversible, especially when caught early. When you lift the anticholinergic burden, many people experience a return of their clarity, energy, and memory within weeks or months. The brain is far more resilient than we often give it credit for, but only if we remove what is actively harming it. The solution doesn't require a miracle. It requires a careful medication review. Sit down with your doctor or pharmacist and have them go through every prescription, every over-the-counter pill, and every supplement you take. Ask them to calculate the total anticholinergic load. There are simple scoring tools available that do precisely this. Once the problematic drugs are identified, you can work with your doctor to taper off those you don't need, switch to safer alternatives, and give your brain the space it needs to recover. This is the most preventable threat to the aging mind on this entire list, and that is precisely why it sits at number 1. Now I want to hear from you. Of these 9 categories, which ones are currently in your medicine cabinet? Have you noticed brain fog or forgetfulness creeping in after starting a new medication? Please share in the comments below and tell me that you will commit to requesting a medication review this week. Your response might be the very thing that helps save the next person who reads it. And before you go, there's one more place your body often hides its warnings. Your medicine cabinet is one place, but your hands are another. Your fingernails can actually flag potential trouble in your kidneys, your blood, and even your nervous system, sometimes years before any other symptoms appear. And most people have no idea what signs to look for. That will be the topic of my next video. I'll be showing you 4 nail signs worth checking tonight. I'm Dr. John Myers. Stay sharp, and I'll see you there.